Neha, that people end up coming to me and saying, for children, my children need this, my children need that, or my kids are going to college in the US, the college forms need to be filled, and these vaccinations need to be updated. I have to literally hold them down and say, what about you? And how about your vaccination? And how about your own protection? So I'm glad that you've invited me to talk about this, because it's a really important topic, and especially for people who have diabetes. Remember that your inflammation or your state of immunity is considered low, and acquiring infection rate is higher. And yeah, I think I want to start the session actually by talking about something which you all are reading about. And I had in my clinic, somebody asked me that, oh, my son is going to Europe and give him the monkeypox injection. And what did I tell? I said, there is no monkeypox injection in India. So monkeypox, just for all of you and to keep that information with you, is a viral infection, and it's spread from monkeys, and then it's come to humans. It's usually self-limiting within a month, but there's a lot of pain, fever, rash. It is mainly right now, according to WHO, in Congo, DRC, and the vaccine also is limited availability for people in Congo. The question that comes is, how does it spread? So the most virulent way of spreading or extreme way of spreading is close contact by body fluids of the infected person. And out of that, the topmost is actually sexual. Then, of course, respiratory also. And also touch or sharing secretions, sharing food, sharing from the infected person. So you can very well get protected. We've all learned about masks from COVID, and we need to be careful in all of the means of making sure we don't touch body fluids. And I think you'll be safe. But for right now, we need to pray for people in Congo and everybody. And it can, if you are immune compromised, or if you have, there are chances of extreme sickness, just like we've had in COVID or dengue or any viral, and that can also lead to end of life. So it's very, very important to remember that it is a viral. 90% cases get self-limited by themselves in 1 month, leaves you weak, just like chikungunya, just like dengue, just like COVID. And so immune building is, so I think this is what is not in my presentation, because there is no vaccine for it. So I thought but I'm sure everybody has this question in their mind and they're reading about it. So, and for those who don't know about it, I thought I'll just start with that. And if you want, Neha, we could start with my presentation and then questions that could be asked on it.
Absolutely, ma'am. Like, I can't wait. There are a lot of things. I think we have been always thinking that vaccinations are only for babies, but then now we think again, and we know that there is, like, a lot more than just for being with babies. And today we have the privilege of hearing you. So I am very excited, and I think without wasting much time, I want to start with this presentation. So just give me 1 second. I'm just going to share my screen. Can see?
Yeah, sure. Thank you, Neha. I hope everybody can see the screen. So it's the most cost-effective strategy available in public health, as I say. And in addition to protecting the vaccinated individual from developing a potentially serious disease, vaccines help protect the entire community. And I know you all are very well aware of it after the COVID. And it helps you also it helps reduce the spread of a disease. And we all know what happened, how the world was protected from smallpox. And that was the most dramatic success in the history of public health. And we eradicated smallpox completely. And there was so much trauma at that time. with smallpox, and today we don't have it existing. Next. So, at present, our public health system has reached a state where basic infrastructure for immunization program, system of vaccine delivery, how to maintain a cold chain. Now, for people who don't know cold chain, it is very important for you to know. So if you're going and getting a vaccine somewhere where somebody is just opening a cupboard and giving it to you, you should know that the cold chain is gone. All vaccines come with a guideline of how many degrees centigrade should be stored in. So some vaccines are stored in the freezer compartment of a fridge. Some are stored, like the shingles vaccine, or the shingles vaccine is stored in the middle shelf. So the cold should not be even on the top shelf or the bottom shelf. It should be in the middle shelf of the fridge. So there's a very, very detailed explanation of how a vaccine should be kept in a particular temperature. And you can imagine where we have pharmacies all over India. And then you also know very well that the power outages in every area. You all have to be very careful about this, where you are getting your vaccine from. Do they have a power backup? Did their fridge that went off in the night was supported for 8 to 10 hours by a backup? It is, and just imagine, I'm talking in Bangalore. Imagine if this was in a small town somewhere else. So maintaining cold chain is a very important part of a vaccine. So now the vaccine production capacity, everything is in place. So this thing really helps the World WHO, the public health system, to be able to create immunization programs and COVID vaccination programs across India were amazing. If you had seen videos of people going on a boat with an ice chest and giving in West Bengal and in water and giving it to these people who were living in little units there where on water. It was amazing to see all of that as a doctor. Adults need vaccinations to sometimes boost efficacy of childhood vaccine. So for all of us in our, I'm not going to put my generation to your generation, but let's go from people from 50s. They hardly got any vaccination. They do have mark of the smallpox vaccination on their arm, but nobody knows which vaccinations were given to you. People from 30s and 40s also sort of I see have 30s, maybe they've got the vaccination was much better vaccination protocols, but in 40s again have very poor immunity because either they got immune because they got the infection or there is no protection. So I see adults in my clinic all the time with massive chicken pox. And they didn't get chicken pox when they were small and they did not get the vaccination. And they get chicken pox and then they're very, very sick because the intensity of all these infections in adulthood is much, much more than it is because our immunities are much poorer than kids beyond 5 years of age or, teenagers or in 20s. So we all have to understand that if you have to take in the adulthood, it might be from boosting efficacy of your childhood vaccinations and newer comorbidities and to afford protection when immunity is suppressed due to acquired illnesses like, of course, diabetes. Neha, next. So the survey conducted among 2,000 adults across 6 cities in India, this is important, in September of 2017, found that for over 42% of adults ranked in good physical health as their primary priority in life. For them also, staying up to date with vaccination is typically less important compared with other ways of staying healthy, such as eating healthy, keeping active, not smoking, particularly among males. 34% believe vaccinations were only for travel purposes. 38% believe vaccinations are for children or babies only, and 26% believe vaccinations are not required if one is fit and healthy. Why do we have these bottlenecks? What is the reason? The perception that adult vaccine preventable diseases are not significant health problem even after COVID. Doubts regarding efficacy and safety of several of the vaccines used for adults. Lack of universal guidelines of adult immunization compared to pediatric population. And I have put in the adult immunization guideline at the last slide, but there is a lack. All doctors, when a child is born, give you a file, and in the file, your pediatrician on the inner side has a sheet which tells you that you can, this is what your child should get at 3 months, 6 months, 9 months, year. And where is that? So you go for your health checkup, and I don't see any such guideline being put on any folders given to you. So in a whole system has to change so that the lack of universal guidelines or lack of awareness of the universal guidelines has to be promoted. And healthy adults are harder to reach through public health system because they don't come for health checkups. So, till 40s, people don't get health checkups. So to reach these healthy adults is very hard. And so vaccination in this group becomes very difficult. These are my own perceptions to bottlenecks that I have put in here. There might be many more, but when I was thinking about it, what have I felt in my experience as difficulties in adults getting vaccination is very important. Now, what are the reasons we need to give immunizations to adults? So we need to, number one, boost protection acquired by immunization early in life. So you can do it again. You need to find out in the absence of natural boosting from exposures to the infectious agent. Accelerate control or elimination efforts. So disease control initiatives, just like, frequently aiming at herd immunity, COVID, interrupting transmission, and covering the non-immune cohorts is very important. And counter-specific risks such as travel, such as high-risk behavior and immune compromised state, all of that, like diabetes and pregnancy are just in general very, very common. And these are things that need to be done here. So the next slide at this point. So diabetes also confers an increased risk of developing and dying from infections. And it is now considered an important complication of diabetes. And we all learned it through COVID, actually. People who had diabetes and uncontrolled sugars had very poor outcomes in COVID. People who were pre-diabetes became frank diabetics after COVID, not just by steroid management, just by the virus lowering your immunity in general, or lowering your body's capability of even glycemic control, increasing inflammation in your body. All these things were the reasons why you unmasked diabetes very highly after COVID. Indeed, the morbidity and mortality associated with infectious disease like influenza and pneumonia, which is I've actually focused because I can't take all the immunizations in one session. I've tried to bring out what's really important and then give you the immunization schedule. So influenza and pneumonia, which are completely prevented. The morbidity and mortality from these are very high. And although people of all ages are prone to infectious disease like pneumonia and influenza, extremes of age and certain underlying medical conditions such as diabetes, asthma, and cardiovascular disease aggravate the risk. Next. So common vaccines administered to adults. And I have listed most of them, but I am telling you because of the time constraints, and I wanted to take your questions. I will sort of go over them, but influenza, pneumonia, herpes zoster, very important for diabetics. Then diphtheria, tetanus, and acellular pertussis, Tdap is called. HPV, human papillomavirus, cervical cancer happens from this virus. Meningococcal, typhoid, hepatitis A alone, hepatitis B alone, or A and B combination. This is what's available to you, and I'll go over them slowly. So the next one is influenza. And I'm sure with influenza, the questions of swine flu come. They're all H1N1 family. Swine flu is H3N2. And what happens is that swine flu is a respiratory disease that came from the pigs. It's caused by type A influenza virus, and it is usually occurs in the pigs, but it has been now going on into humans also. Influenza virus or seasonal influenza A, which is H1N1, and a H3N2 viruses that commonly spread in people like human influenza viruses. There are different subtypes and strains of this H3N2 swine influenza virus. How does it look like? Fever, tiredness, lack of appetite, coughing, running nose, sore throat, eye irritation, nausea, vomiting, and sometimes diarrhea. And sometimes leads to very serious illness resulting in hospitalization and even death. From US, I couldn't find the data of calculation in India, but in 10,000, 100,000 flu-related hospitalizations and 4,900 flu deaths in the 21-22 season alone is the data from US from influenza. Imagine this was also along with COVID. So they had to separate the two, their blood tests, their throat swabs, all had to show. But they have the data till last 21-22. So I thought, just for everybody to understand how important it is. As a doctor, I really recommend people to get their annual flu shots. Next, Neha. The available vaccine of influenza is a killed. Now, there are two kinds of vaccines, killed and live, and I cannot go into the microbiology of that. So let's take it. It's less, causes less side effects or a fever or body ache. So killed virus vaccine to be given through the muscle in your arm usually. And as the influenza virus constantly mutates, every year we make a new batch and CDC releases the strains. As doctors, we need to know before we store it in our clinics or hospitals. We need to know when somebody is sending us from our pharma, whatever that is, wherever it comes from, I need to make sure that there are exact names on each batch. So sometimes they'll send us the old batch, which I will return, because it's very important that we look at the strains of the viruses in each year's new batch. So a new batch is prepared every year. The vaccine becomes effective against influenza 2 weeks after taking it. And since the peak of the flu season begins in October and lasts till May, I would suggest October early and November at the latest are the best times to receive vaccinations. A single dose of inactivated, which is killed virus flu vaccine, 0.5 ml is given IM in terms in your deltoid muscle. It also protects adequate infection against swine flu, and antibody monitoring of this vaccine ki bani ya nahi bani is not required. I take it every year because as a healthcare provider, I am exposed to tremendous flu in the flu season. Now, people take the flu vaccine and the common question is, oh, I again fell sick. So the chances are if you are sick from the influenza A and B virus, the intensity will be much less. You can have a cold or cough, but you won't end up really, really sick. But there are other viruses that are very similar, which are called the common cold or the coryza or the coronavirus of the cold, which can give you such symptoms also. So not everything that you're getting is influenza. Now, who really needs influenza virus are people who have lung disease, emphysema patients. Oxygen carrying capacity is low, immunity is low. And they really need this vaccine. People who have kidney dysfunction end up having low hemoglobin, low immunity, higher inflammatory markers in their system. People who've had stents and bypasses, who have congestive heart failure, but they don't pump, the pumping of the heart is less. Diabetes, metabolic diseases, hematological diseases, iron deficiencies, and multiple myelomas, and whatever is there. A pregnancy, people who live in nursing homes, of course, healthcare personnel like me or anybody who deals directly with patients, nurses, or whoever is exposed to patients who might have it. Immunosuppressed individuals with cancers on chemo or whatever. Elderly people more than the 65 years of age, and children between the ages of 6 months to 5 years are building their immunity. Their immunity is less. So let's try and give them a flu vaccine to help them out. And that was all about influenza. And you can hold your questions till the end and then ask me your questions. Number 2 is the pneumococcal vaccination. And remember, I start this presentation by taking away the confusion. There are 2 different kinds of pneumococcal vaccination. And I put both for myself, but I'll explain to you why. And they help prevent pneumonia by streptococcal, which is a bacteria. And that bacteria is notorious for hospitalizations and deaths. So it does not control all pneumonia. Pneumonia is by many other bacteria, not just streptococcal. But the studies and the estimation has shown that streptococcal pneumonia is the worst outcome pneumonia, and maximum deaths still today in the ICUs happen from this pneumonia. So this is very preventable. It's called the Streptococcus pneumonia, serotype A. There are two kinds of vaccination. One is the conjugate vaccine containing 13 serotypes. That is available in India, Prevnar 13. In America, we have newer one, which has 20 serotypes, obviously a better control, and it's called Prevnar 20. There's an in-between somewhere, Prevnar 17. In India, we have 13. And a polysaccharide vaccine, which is not the conjugate vaccine, containing 23 serotypes. Now, when you see the polysaccharide versus conjugate, a conjugate vaccine is always much more superior than the polysaccharide vaccine. A conjugate vaccine causes you to build up immunity much more than it is, because what it really does is that they take a part of another inactive part of another bacteria, and then they build up the vaccine of the pneumonia, streptococcal pneumonia, on that toxoid. So your body feels that they need to make antibodies against 2 agents rather than 1. And that is why the immunity in a conjugate vaccine is much more than a polysaccharide. So the polysaccharide vaccine consists of polysaccharides of just 23 serotypes. This vaccine is less immunogenic. We want more immunogenic. Does not affect carrier rates. So it does not give you a better carrier. It does not affect people who are carriers of streptococcal pneumonia, promotes herd immunity, or it does not protect from respiratory tract infections, as there's no mucosal immunity. Conjugate vaccine, on the other hand, consists the capsular polysaccharide covalently bound to diphtheria toxoid and is highly immunogenic and non-toxic. This combination results both in immunogenic immunity and lifelong immunity. Now, you should, by looking at this, a common person should say, oh, I'm going to go for the conjugate vaccine in the end of the story. But because the polysaccharide covers 23 serotypes and this covers 13, there might be an added benefit of the polysaccharide, the 10 other serotypes it carries. So the recommendations are, I'll tell you, are to take both. Go ahead. Yeah. So who should take it? Every single person above the age of 65. They first take the conjugate 13 called Prevnar, and 8 weeks later, a polysaccharide PPSV23. And as I said, there's a new one of PCV20, and it can be taken as a single vaccine. Then we don't want to wait for, they give you another vaccine for 3 serotypes. But sometimes people, the American CDC allows that even if you've taken both these before 65, after 65, you want to take a PCV20 for additional immunogenicity, you're allowed. People from 19 years of age to 64 years of age, chronic heart disease, kidney, lung, liver disease, diabetes, immunocompromised condition, emphysema, and COPD should take this. It just generally covers everything. Can we go back one slide? I just want to talk a little bit more. So pneumococcal vaccine, remember that children, I want to mention who has children, they've actually gotten Prevnar 7. They've taken 3 shots, I think 2 shots or 3 shots of, forgive me because I'm not a pediatrician, but 2 or 3, either of those. They've taken the 7. And my children took that too. But the minute they became 19, I did give them Prevnar 13. And when they become 65, I would suggest they take the PCV 20. Because remember, it's a human body, not a machine. Everything that we promise works differently in every human being. I might build up an immunity that will last for 50 years. You might build up immunity that lasts for 10 years. Does not matter, or either way. But you need to understand that after 65, I would say whenever you take the course of these two vaccines, if 5 years have passed from the age of 65, so you took these vaccines before 60 years of age, I will give you one more booster after 65 because I know that immunogenicity reduces with age and worst mortality happens to elderly with pneumonia. Now we can move. And now all of you must be hearing about the shingles vaccine. Amitabh Bachchan came in with a ad for it. And so let me tell you why it is so important. And let me tell you that I've taken both the shots of shingles vaccine. So all of us, I think 35 and above, have not received the chickenpox vaccine when we were young. And as a result of it, 90% of us had chickenpox, and for North Indians, we call it Choti Mata. But chickenpox is usually when we were kids, we had a small activity of chickenpox. So shingles is a very, very painful rash, extremely painful. I've rarely seen people get away without. It always affects, and I'll tell you why, one half of the body. It can never cross. So if there's a rash that looks like shingles, but it's on this side also, you don't have shingles. It's not humanly possible. Explain to you later about that too. So shingles usually sitting on a nerve. Why? Because this chickenpox that we had when we were kids, that sat inactively on one of the nerve endings. It could be starting from in the spine, from the top of the head nerve to face to neck to body, anywhere. It is sitting on a dermatome of the nerve coming out of your spine. Stress, lack of immunity, illnesses that reduce your immunity, elderly age, all causes that virus to become active and give you this terrible rash. And the problem is not the rash because we give you medication or whatever. It is the residual pain that stays after that rash is gone. The pain, people come to me after even 10 years, and it's called post-herpetic neuralgia. I have seen people lose their vision. I have seen people lose their hearing. I have seen people not being able to walk or exercise and living in chronic pain, unable to wear any thick clothing because that nerve, that pain just does not let them breathe. Enough in 30 years. And we had in America a vaccine called Zostavax, which was not a conjugate vaccine. And they've been working on this vaccine, and I've been waiting for it, I'll tell you, over the years, because as a doctor, if you sit behind my desk and you see the amount of cases of herpes zoster that I see, you would say, oh my God. So the kids who received, like my kids, who received varicella zoster vaccine, they have never had chickenpox. And because they've never had chickenpox, there is no reactivation that's going to happen. So as they get older, getting them a shingles vaccine for re-immunity is very important. So my deal is that as soon as my children come to India in December, I will check their antibody level to chickenpox. And if it is low at this point, before getting them into a horrible situation of adult chickenpox, I will give them a shingles vaccine, single vaccine, because they've had some vaccines when they were chickenpox vaccines when they were young. So it's a very painful rash illness, and it causes chickenpox, which reactivates in their body after they've already had chickenpox. Shingles can lead to serious complication, and the most severe complication is the post-herpetic neuralgia, PHN. If you are at a risk for shingles, if you had chickenpox in the past, and you might not even know because the chickenpox in childhood sometimes came and went and nobody found out. But if you have medical conditions that keep your immune systems from working properly, such as cancers, leukemia, lymphoma, HIV infections, you are at risk. If you have taken drugs that keep your immune system from working properly, like steroids and drugs given after an organ transplant, as you get older, next page. And of course, anything that compromises your immunity also makes you. All adults by the World Health Organization beyond the age of 50 should vaccinate from shingles. So vaccination is 90% effective at preventing shingles. And remember, the name of the vaccine should be Shingrix. It's the new conjugate vaccine and not Zostavax. So 90% effective at preventing shingles and post-herpetic neuralgia in adults 50 years and older with healthy immune systems. Adults 19 years and older who might have weakened immune systems are at higher risk of complication. For example, diabetics should also get vaccinated. And the recommendations are 2 doses of Shingrix, 2 to 6 months apart. So you can do the first vaccine, you can do 2 months, 3 months, 4 months, but beyond 6 months, the immunity wears off the first one, so it doesn't work. So within the first 6 months of the first dose, you need to take the second dose. Apart from preventing shingles and related complications in adults 50 years and older, Shingrix is also recommended for adults 19 and older who have weakened immune systems. Next. So these are the vaccinations that I wanted to talk to you about, because I really feel for diabetics, these are very, but if you look at age group wise that I have put in this vaccination schedule, this is my actually last slide because I want you to ask questions. So age 19 to 21, and I think we are going to put this on YouTube so you can look at it later too. 22 to 26, 27 to 29, 50 to 64, and these are for healthy adults, okay? Remember, this is not just for diabetics. So if it's applied for health, so first is the influenza, 1 dose annually. I do not recommend taking the live attenuated influenza vaccine, which is nasally given as a drop. I would like you all to take the killed virus vaccine, which is very effective, and it is given in your arm. Then remember tetanus, diphtheria, and pertussis. Now, tetanus, I see people saying, oh, I got injured, I got tetanus. Dog bite a little bit, got tetanus. Listen, tetanus injection covers you for, it's called DT, it covers you for 10 years. But I really think that a DT booster or 1 dose of Tdap, which is acellular pertussis, I see it in adults with coughs, every 10 years is the right thing to do. But if you're not taking that, and if you're taking only tetanus toxoid, you can take it also once in 10 years and you'll be protected from any risk of tetanus. MMR. So if you're born 1957 or later, okay, so you can see if your exposures are high, your immune systems are low. Yeah, you can check your mumps, measles, rubella antibodies and see if your immunity is not enough, and then take this if need be. Varicella is chickenpox, and in adults is recommended 2 doses if born in 1980 or later, is to be taken for a healthy person. And I will recommend now, Shingrix should come. It's not here right now because this is the schedule, they've not updated, but in this, you can add a Shingrix after 65 years of age. Or now itself, if you take, this will all change. The varicella vaccines will be 2 doses, of course, for like the Shingrix that we talked about. And then after 65, 1 extra dose. And then see, the next one is the RZV, which is the Shingrix. And it says there is no zoster live. We are not giving Zostavax at all. So forget about that. But the 2 doses are recommended for everybody. I think they say 50, beyond 50, but let's check our children if their immunities have gone down or our immunities have gone down with the antibody checks and take it. HPV, or the human papilloma virus, which is basically the cervical cancer preventing virus. And it is, I usually only give it till the age of 30 as a doctor. And usually 2 doses for people who take the first one earlier before the age of 14. They need 2 vaccinations. People who take it after the age of 14 need 3 vaccinations. Pneumococcal conjugate is PCV13, one dose 65 plus, or immune compromise. This is only for healthy adults, not for truly diabetics. And I could not find immunization protocol anywhere suggested only for diabetics. Hepatitis A, B, very important. Check your immunities. Check. A gives you jaundice, B gives you, it's mainly through blood transfusions, sexual contacts, or parent to child through the placenta. It is bloodborne and it can lead to cirrhosis and hepatocellular cancer. So check your immunities, guys, and check. Your doctors all know how to check your immunities and take vaccines if need be. Meningococcal vaccines, it is, meningitis is not that, but if your kids are going to a dorm or staying in a community living, so people who are in nursing homes or in community livings, there can be an epidemic of meningitis. So those are people we recommend that. Meningococcal B not available in India, and Hib is also not for adults. That they write it 1 to 3 doses if you want to, but not that commonly given. So I want to thank you for giving me your time and listening to this recommendations. And I'm ready for any questions that you might have.
Thank you so much, ma'am. I think this session was really very knowledgeable and enlightening.
Thank you.
If you have any question, please write down in the chat section. We will keep on taking. I'll start from now. Ma'am, first question is by Mr. Prashant. Please recommend very essential vaccines for diabetes.
I already did that, Prashantji, and I'm sure you've heard the talk by now, and you've understood that please make sure yearly influenza vaccine, make sure pneumococcal Prevnar 13 followed by PPSV 23, and Shingrix, most importantly. You need to discuss with your primary physician. You need to understand that I have written every single thing, which is, and let me also tell you that typhoid is important once in 3 years. So there is a combination of typhoid and tetanus too. So I give a long discussion in my clinic where I can give, so your doctor who you go to in your clinic will explain to you hepatitis A, B, combination of A and B, how to take that. Think about Tdap once, MMR, do your immunity, varicella, do your immunity. But really, if you've had chickenpox in the past, checking your immunity should not prevent you, but you should definitely take Shingrix and pneumococcal and influenza.
Yeah, there's another question, ma'am, from Mr. Nadesh. Can we import these vaccines from USA?
Cold chain, travel, how are you going to do that? They all come from the US, by the way. So Shingrix is a GSK-made US FDA approved. A lot of the vaccines that you're going to be taking, if you get them from companies like GSK or Sanofi, which is Europe, you will see that they are transferred from there. I would definitely take it from a tertiary care or a good standalone, fabulous clinic where you have your doctors available, who you know and trust, have a pharmacy that looks extremely well kept, and their equipment has backup power.
There's another question. How much gap one should give in between 2 vaccinations?
Every vaccine has its own, but the influenza is every year. And let me explain to you other things also. Very important question. Thank you for asking. This is very important to clarify some doubts. Pneumococcal vaccine, as I explained to you, I usually give it 2 months apart. The first Prevnar or the conjugate vaccine of 13 serotypes, the first vaccine, and I give the PPSV 23 at 2 months from that. Shingrix, again, I explained to you the first vaccine to be taken when you have to take, and then the second vaccine is between 2 to 6 months of the first vaccination. HPV is 3 vaccination, 1 month. So 0 day, first day, then 1 month later, and then 6 months later. Hepatitis A is actually a single vaccine 6 months apart. Hepatitis A and B combination are 3 vaccine, 1 month. So every vaccine has its protocol given to us by CDC. And as doctors, we need to warn you that if you cross those dates, we might have to restart the vaccination. So it's very important for you to follow that. But saying that, Neha, you all must have seen little babies being given 5 vaccines together in their thighs. Two. Why are we so mean? Why are we giving these kids vaccinations like 5 together, 7 together? Remember, either you give a vaccine together and the immunity, just like how they make a conjugate, they bind it to a diphtheria toxide and the immunity increases. Similarly, if you give vaccinations together, your immune system goes on a massive rut to make antibodies and your body just gets so beautifully immunogenic to all. But suppose you took one, you tell the doctor, no, can't do this. Can you give me 1 week later? The doctor will say, no, I can't. And the reason they'll say it is because if within 4 weeks, so the maximum immunity in your body is generated, whatever it has to do within 4 weeks. So if we give you a vaccine, the next vaccine cannot be earlier than 4 weeks because we do not want to interfere in the immunogenic capability of the first vaccine. So we give you a second one only 4 weeks later. So tell your doctor, give me 3, 4 together, whichever ones can be given together. There are certain which we worry about and don't give it together. But if they can be given together, rather take it together, bear the pain, like the babies, they who don't have a choice, and get your immune systems going. So this question I answered in 2 parts. I first tried to tell you that the type of vaccine and what is the protocols to be given. And the second part is that please don't spread out your vaccine 2 weeks apart or 1 week apart. You spread them out 4 weeks apart or you take them together.
Thank you, ma'am. Ma'am, another question by Maria. How are you going to check the immunity? So what are the...
There are antibody levels in your blood that checks your immunity. There are only certain antibodies that we like to check. We don't like to check everything like influenza where there's a mutation. There's no point doing antibody checks on those. Pneumonia, we don't check antibodies, but we check antibodies for MMR, mumps, measles, rubella. We check for varicella zoster. We check for typhoid antibodies. See, when you do blood tests for people who have antibody, we do Vidal and we do typhi.IgM. These are all antibody level checks. And some are quantitative, some are just positive, negative. So hepatitis B, all of them have particular antibodies. Your doctor knows it. It's a blood test and you just see how immune you are to something.
Ma'am, next question is by Bronwyn. If we get any mentioned symptom of sickness, does taking the vaccinations after that work, or what's the process for the same?
Did not get the question. Can you start? I couldn't hear it.
If he already faced any of the symptoms we mentioned by you, then can he take the vaccination after that?
Yes, absolutely. So intensity come kar deta hai because the vaccination starts along with your disease, which is trying to, your immune system is trying to fight that. So it's already in a process of trying to work towards immunity. You give a vaccination, the immune system goes under a gear and it can cause further antibody buildup, which causes the severity of symptoms to go down. Now, for example, you've had the typhoid. Aapka typhoid ho gaya, 1 mahina ho gaya, dawai ho gayi, everything. I will recommend typhoid vaccination within 3 months of an infection because you do not, after 3 months, your body is gone. Infection generates only so much antibody, but a typhoid vaccination will generate a 3-year immunity. So I will say to people, like for example, people with chickenpox come to me and I say, "Aap le lo, vaccination bhi le lo," because I want to, I don't want them to suffer vision losses or hearing losses, and I want the immune system to go into a gear. I will give it to them. So you can very well take it.
Yeah, I think that was like not very clear to me also. We got to learn something new. Okay. Ma'am, there's another question that name is not mentioned, but he wants to ask, there are so many vaccinations, which is necessary to take?
I already sort of have given my presentation, and I clearly told you influenza every year for you if you're diabetic, pneumococcal, definitely, 2 vaccines in lifetime. And then the third one was shingles. So I have actually put my 3 choices topmost.
Thank you, ma'am. Ma'am, Nadeshji is asking, his doctor is already there in USA. Can he, when he is visiting there, can he take the vaccine?
Yes. Yes, you are assured of cold chain and you are assured of the right vaccinations, I hope. That I don't know because cost saving is a big factor. But I think vaccination-wise, they are really good because they really know that that prevents hospitalizations and deaths and further loss of money by the insurance company. So they might give you the best vaccine. Yeah.
Ma'am, Vijay ma'am wants to ask, she's 68. She got herpes zoster 4 years
That
back.
is shingles. That is shingles.
Yeah. Should I take shingles vaccine now?
Absolutely. It can reoccur. आप please, कब हुआ था उनको infection?
No, she's saying I'm 68. I got herpes zoster 4 years
That is
back.
shingles.
Yes.
But she doesn't say when.
He did not mention about it.
Okay, so if you've had it in the last 2 months, you can wait one more month. But other than that, you need to take it. It reoccurs.
Okay, there's another question. Is there any side effect of taking so many vaccinations in a year?
You can space it out rather than, so the first question, side effects. You're talking to a doctor who totally believes in prevention. And I have seen everything from treating 50 patients during COVID every single day and just seeing the suffering and then people getting better and COVID being conquered by vaccinations. And it's not just COVID. I've always been very proactive about vaccination. I'm not an anti-vacciner. I'm a very, very proactive science-based person. So I will say that there is no side effect. Okay. Now, saying that, I don't want you to think that there is no side effect. There's one side effect that everybody, besides allergies. So a lot of basis of vaccine productions is egg. And then there are people who are allergic to eggs. They have to mention it to the doctor. And the allergy to egg would not be just ki pet kharab ho gaya, wo nahi. Allergy to eggs would be massive rashes or severe allergy. If that is the case, we won't give it to you because now they're making newer vaccines where they don't use egg as a base. Number one. Number two, there is a syndrome called Guillain-Barré syndrome. Now, Guillain-Barré is a viral generated autoimmune reaction in the body where you have diarrhea and you'll have even paralysis. Okay. This is one side effect which till date in 30 years, I have never seen a person have it, but it is mentioned and it can happen. There are certain people who are more susceptible to Guillain-Barré. Like for example, if I have patients who have autoimmune, massive autoimmune lupus so we have to, that is why take vaccination after discussion with our doctor. To be very clear, read up on it, everything is out there. See, the advantage of allopathy, I tell people, is that you have the negative and the positive all written to you. While in the other alternative fields, I see people taking green pills, white pills, black pills, not knowing at all what is going to happen to them with those pills, or what is the data written on it, or what is the research showing, what is the adverse effect of something. So everything is out there. Talk to your doctor, talk about your risk factors, and let them make a call. We have to stop this habit of going to the pharmacy and saying, "Dawai de do," and we'll start taking it. No, I'm giving you this knowledge today because I want you to go ahead and talk to your doctor, start a conversation, see if they can suggest to you. My suggestions are these, but please don't take my suggestions and go to a pharmacy and get vaccinated. You still need to talk to your doctor.
Thank you, ma'am. Next question is from Partho Gangli that he's a 67 years old diabetic person, has BP last 20 years. Should he take the doctor's prescription for adult vaccination, and where do I get these vaccines, especially PC13 or PVC23?
They are available everywhere in any tertiary hospital, any good standalone primary care center. They are easily available everywhere. You don't need to search for them. You can take your prescription from your doctor, handwritten, and go anywhere and the nurse will give it to you. Just make sure it's a good hospital and a good standalone tertiary care, primary care center.
Thank you, ma'am. Another question is from Mr. Ganpat. After recovery from the last stage of muscle, is it what are
Sorry,
your
Mehra,
suggestions?
your voice was lost completely.
Okay, ma'am, this is a question from Mr. Ganpat. After recovery from the last stage of COVID, he's suffering from low immunity and weakness in the muscles. What would be your suggestion for him? Do he require any vaccination to overcome the weakness?
So you're talking about vitamins. You're not talking about vaccinations. So if you're asking me to overcome
Yeah,
your weakness or feeling weak, please make sure you take good amount of multivitamins, water, good amount of diet. Slowly, everybody comes to their usual status. It's called long COVID that you're talking about, and there is basically vitamins and good food, sleeping well, all of those which we talk about lifestyle, which promotes your healing. But if you were asking me which vaccinations you are taking, it applies the same thing for you. There is no difference from people who have suffered from long COVID, what to give and what not to give. There is no such guideline. You still are applicable if you have diabetes and if you have low immunity. All of the above, as I have explained, applies to you.
Mama, I think we are done with all the questions. Thank you so much. But one question I want to ask that people are still very hesitant in giving their female child a cervical cancer vaccination. What is your take on this? What do
First
you?
and foremost, Neha, it's not just for females. And this is something that I really want all mothers who have boys and girls to know. So the HPV vaccine covers the most dreaded cervical cancer virus strain, human papilloma virus strain, which is 16 and 40. They're the ones that cause cancers. Now, HPV are carried by all men. Men are the carriers. Okay. So if you ask me, I've given it to my son. Yes, both vaccines given. The reason being is that you have to stop the carriers. You are giving it to women to protect them, but where do you stop the carriers? So all kids after the age of 14, and we can eradicate cervical cancer from the world. Each of us have to be responsible. There is no, I don't know why we give choices that you have to take or not to take. You have to take, be it a boy or be it a girl. You give between 11 to 14, your kids only need 2 vaccinations. If you give from 14 years and above, you need 3 vaccinations for the course. So yes, human papilloma virus has to be given both to kids, both kids, female and male.
So much, ma'am, because I have been told by my pediatrician that you should give it only to the female child. So that was really an eye opener.
No, it is for both male and female. And you asked me, I give it to my son too.
Great, ma'am. I think it was a wonderful session, a lot more to learn from you, and I hope you will keep on coming and joining us. Thank you so much for your time. It means a
Thank you,
lot to
everyone.
have you
And
here.
yes, good luck, good health, good immunity, and take care. Bye bye.
Thank you so much, ma'am. Have a good day. Thanks, everyone, for
All of you
joining.
have
I
a
hope
good
you
day.
find the session informative. Thanks a lot. Have a good day.